Join the conversation.
Join the conversation.
You're with Cape Talk.
Guess who's back? Back again. We missed him. We missed him 2 weeks without him. Dr. Chris Smith, the Naked Scientist, is back. He's back to answer your questions. I'm sure it was a very much deserved break. Chris, I hope you soaked it up.
Hi, Clarence. I had a lovely time, actually. Yeah, it was really nice. And so thank you for the warm welcome back as well. That's really touching. I didn't expect that. It's nice to be back.
That was Amy's touch, you know. Amy's got
thanks,
that
Amy.
touch. Joe and I know nothing about Eminem. We know the stuff that we put into our mouth, not the music. But yeah, back again, and I know we've got a voice note. Let's start off with a voice note, Joe.
Hey, Clarence, Ed here. Good morning, Dr. Smith. I'm of the habit of running around outside doing my various exercises and PT at like 6 o'clock in the morning. And in Cape Town, it is, of course, completely dark at that time of day. And occasionally, our cat decides to inspect my activities by standing next to me and watching me as if I'm crazy. And I use a headlamp torch while I'm doing this. And occasionally, well, quite often, when I shine the torch in her direction, her eyes reflect back two different colors, a sort of greeny yellow and a sort of bluish color. Most of the time, though, they are both a yellowish, but sometimes different colors. And I thought that it could have something to do with the angle of light hitting the lenses from my headlamp torch, but it seems to happen from all different angles. And I was wondering why that might be.
Morning, Ed, and congratulations on your regime. You're doing yourself a power of good. I only wish I had an ounce of your same commitment and self-control. The cat eyes. Right, well, there's a reason why the things we embed in the surface of roads are called cat's eyes, that reflect headlights back and show us where the edge and the middle of the roads are. Not just cats that do this, though. If you shine your lights at a dog, you'll see that dog's eyes glow mysteriously in the dark in a sort of demonic way. Most nocturnal animals do this, and the reason they do this is at the back of the eye, in nocturnal or night-active animals, is a structure called the tapetum lucidum. It's Latin for bright carpet. And the reason it's there, this highly reflective layer, is that in animals that are active in the nighttime, because they are operating in very low light levels, the way the eye works is that light is focused by the front of the eye, the cornea, and then that focus is tweaked by the lens to force the light onto the light-sensitive sheet, the retina, at the back of the eye, where you turn light waves into brain waves. But if you miss the opportunity to see that light, you'd miss the opportunity to see. And if your life depends on seeing something in the dark that might be wanting to turn you into dinner, or something you could turn into dinner, then you either go hungry or make someone else less hungry. Either way, you don't want that to happen. And this is why this structure, the tapetum lucidum, has evolved in these animals. Light that misses the retina the first time bounces off the back of the eye on this tapetum lucidum, and the retina has a second chance to pick it up. Now, obviously, the focus is going to be less precise. You're going to have lower resolution, so you get a blurrier image, but you see something you otherwise wouldn't get the chance to see. And all of the different wavelengths are going to get focused in that way. And the reason you see the eyes glowing in the dark is that when the light goes into the eye, it bounces off the back of the eyeball, off the tapetum lucidum. Some gets picked up by the retina, but some also then gets reflected back out of the front of the eye, and you get to see that light coming back to you, which is why it looks like their eyes are glowing in the dark. Now, our eyes don't do that because we don't have this structure. Our eyes tend to produce red eye because the back of the eyeball has got so much blood in it, you see red in some photographs. But dogs and cats, you're going to see these bright colours. And it's going to depend to an extent on the angle that you are shining the light at the dog's eyes. And also different animals have a slightly different tapetum lucidum, which might also make a difference. And of course the light source is going to make a slightly different a different effect as well. So all of those factors are going to result in you seeing that light coming back out either a greeny or yellow hue according to the angle you've shone the light in and the light source that made the light in the first place.
Thank you for that question. Our news department has been reporting it throughout the morning, a recent breakthrough from researchers at MIT with the help of artificial intelligence has led to the discovery of a new class of antibiotics that can combat drug resistant gonorrhea. I think a question related to that news story that has repeated itself in the news bulletins this morning. Let's take a listen, Joe.
Hi, Clarence and Dr. Smith. I have a question about finishing a course of antibiotics. So we're always told we must finish our course of antibiotics, otherwise we're going to develop antibiotic-resistant strains of bacteria. So my question is, if the bacteria are going to mutate to be resistant to antibiotics, what difference does it make whether I finish the course or not? Thanks. This is Matt.
Hi, Matt. This is a really important point because we're on the precipice internationally of a problem that we hoped would never arrive, but has. And that is that we are now seeing infections for routine things that we just can't treat anymore because the bugs have become so resistant to our drugs. Now, why should completing a course of antibiotics be a good thing to do? Well, this is a compromise. We want to give enough antimicrobial drug to somebody to make sure we treat their infection. But as Alexander Fleming discovered, when he discovered penicillin 100 years ago, very quickly he saw resistance emerging. As soon as you start using an antimicrobial agent, you will start seeing resistance. And he documented this, and Fleming said there will be resistance problems because the bacteria evolve and they do it very, very quickly. So what we're trying to do when we use any antibiotic, we know the more of an antibiotic we use, the more resistance we're going to get. So what we're trying to do is hit the sweet spot between giving people adequate treatment to make sure that we clear their infection, but not over-treatment, which increases the risk of side effects because you're also demolishing the good guys along with the bad guys, and you're driving more disease resistance. So in recent years, what we've actually done is to try to bear down on how long we treat people for. And we've realised we don't need to give people such long courses for some infections. So we've reduced the duration of treatment for some more trivial things from what would have been perhaps a week down to a matter of days. But the reason for making sure you do treat your infection adequately is that bacteria don't just suddenly flip a switch and go, today I'm not resistant, tomorrow I'm resistant. This is an evolutionary process where usually by gradations they become more resistant over time and then optimize that resistance. So there will be a mixed population of microbes in your infection, some of which are a bit resistant to start with. And as they optimize that mechanism of being resistant, more of the population have it and more of them have a better way of being resistant. So if you make sure you treat them properly and effectively, you soak up not just the susceptible ones, but also the ones at the margins that are becoming resistant, and you make sure that you clear this. But what we don't want to do is over-treat people and then increase the rate at which resistance is emerging. And what we're seeing around the world is a big problem with people partially treating infections. And this is really, really obvious with tuberculosis. Because to treat TB properly, a big problem in sub-Saharan Africa, about 90% of the world's TB problems are in sub-Saharan Africa, especially where HIV is a partner in crime. When people have TB, you have to treat that infection for months, sometimes 6 months, sometimes longer, to clear the infection down. Now, often what happens is people present feeling really poorly and they get whatever drugs they can. This immediately makes them begin to feel better. They then have a compromise or a decision to make. Do I want to spend more money I don't have on drugs that are treating an infection that actually I feel better now, so do I really need this? Versus I'll go hungry, but I will stick the course and treat my TB infection. Most people facing that hard decision will go for the former. Take a few drugs for a while, feel better, stop taking the drugs. What have you done? You've selected for microbes in your infection, in your infecting population of bugs that have some degree of resistance to the drug. So the next time you try and treat it, you have to treat it a bit harder because the population that are there are now a bit resistant to the drugs. And you can see how with cycles of this happening, you become more and more resistant to more and more drugs till you get to a point where you just can't treat the infection. So that's what we're trying to avoid, is partially treating infection and also minimize the exposure of the environment to antibiotics, because that drives resistance. And so we're trying to hit the sweet spot somewhere. And part and parcel of that is good antibiotic stewardship, using the right drug for the right infection for the right length of time, but also investing in making new drugs that work in new ways that the bugs haven't learned, in inverted commas, to become resistant to yet.
Could you please ask Dr. Chris what he thinks about the projections that at the current growth of AI and the hardware required to power it, in about 5 years' time, the world literally won't be able to generate enough electricity to power all this hardware, resulting in the AI bubble bursting with catastrophic consequences?
Well, we know that the computer industry does use a lot of energy, but what people will argue is, on the one hand, we've got a situation where AI is using energy, we're running data centers, we're powering computers. But on the other hand, we've got a situation where it is through discovering new ways to do things or making processes more efficient, we're saving energy. So it's not as straightforward as saying we do this, we burn off energy. We will save some energy through doing this. We'll save some people going to work and having a carbon footprint, for example. But it's certainly true that the internet is increasing as a proportion of our energy consumption. And about 10 years ago, the figure was floated that if you add up the energy output or energy consumption from data centers, which are these big buildings stuffed full of servers that are powering the internet, it's about equivalent to the carbon footprint of the airline industry. I suspect that number is now even bigger, but at the same time, if people are using Zoom calls to have a conversation and not have to fly across continents, there's a reduction in the carbon footprint. So it's not as simple as trading one over the other, but certainly people are looking at this, and they're also looking at ways to make sure that we drive more green energy to drive the process of powering the internet, and also shifting the computing to where it's needed on Earth. Let me explain. At the moment, if we put a data center in London, and today it's going to be 30 degrees in London, you're going to have to spend a lot of money to run the computers, but probably spend the equivalent amount of money running air conditioners to keep the computers cold, and you're shifting data being processed there from one side of the world to London to process that data and then send the results back elsewhere around the world. Not very efficient. Much better would be to say, well, let's have a data center in various places, and when the sun is shining, power it with solar panels nearby or wind turbines nearby, and cool it using cold water nearby, and we shift the computing round the planet rather than shifting the data round the planet. So you send the problem to a data center near where there's lots of energy, lots of green energy, lots of opportunities to keep things cool, rather than just doing the same thing in the same place every time. So there's a range of ways that people are trying to tackle this problem.
Good morning, Naked Scientist. My question: why do we sometimes get high-pitched ringing in our ears that no one else can hear? That question from Andrew.
Hi, Andrew. Yes, this is a strange phenomenon, and he's not referring to the normal sort of tinnitus that 1 in 5 people get as they get older, which is sounds which you perceive, but there's no external sound. There are phenomena from time to time where all of a sudden you'll hear this very high-pitched ringing sound, often in just one ear, and often preceded by sort of pop. And I think what happens is that there's a pressure change, an abrupt pressure change in your ear. Perhaps a bit of mucus or something had blocked up your ear. It clears, and it clears with an abrupt change in pressure, which is a bit like someone slapping their fingers together, or clapping their hands next to your head. It produces a little sort of sonic boom inside your head. Not a sonic boom, but you know what I mean. You get a sudden loud sound because of the click inside your ear. And I think that pressure change then temporarily tickles your hearing system, making it feel like you've heard a loud sound, and you get that temporary ringing in your ear. I've had this. I think that's what's going on, but I am going to go and ask a friend of mine who's an ENT, ear, nose and throat specialist, and ask them if I am right. So I'll take that away, Andrew, and I'll come back and confirm that that's what's happening next week. But I suspect that's what it is. It's an abrupt pressure change inside the ear because of some plug or mucus dislodging, causing the eardrum and the hearing apparatus to move a bit, and that causes that little sort of temporary shock. Is as though you've heard a loud sound and you get a temporary sort of ringing sensation. But I'll come back to you next week and confirm if that's true.
Let's go to Greta. Greta's in with a WhatsApp voice note.
Hi, morning. My question for Dr. Smith is about Bell's palsy. I got Bell's palsy when I was pregnant in my third trimester, and I had dense right side bowels. Extremely painful, neural pain. They said it was probably similar to like pain that you get with shingles. And I just wanted to know if you could explain a little bit more about what it actually is and the cause, because now it is almost 9 months later, 10 months later, and my face has regained most of its movement, and it's no longer drooping in the corners of my mouth and things like that. But there's still a part of my nose that doesn't um, pinch. Like if you raise your nose, it doesn't squish. And then around my eye is always twitching, my right eye, and it just always feels like it wants to close and it's tired. Um, I've seen an ophthalmologist, and the health of my eye is fine. The blood flow, everything is fine in the cornea and the back of the eye. Um, and they just told me it's because I have dry eye that my eye is always twitching. My question really is, does he know anything about how long it might take for it or am I to live with this? I know it's not the end of the world, but I just wanted to know if there's any insights into it and what it actually is. I know that the sheath of the nerve gets damaged, but it's just so difficult to understand, really. Thank you.
Well, the answer is Bell's palsy is very, very common. And the reason it happens is that the muscles of facial expression, the muscles you use when you smile, blink, close an eye, blow a raspberry, they are all powered by your facial nerve. And the facial nerve comes out from inside your skull through a really tight aperture, stylomastoid foramen, and then out onto the surface of your face as 5 branches which go into all the major muscle groups. And because it comes out through a very tight hole, anything that causes swelling on that nerve can squeeze the nerve as it goes through that hole and pinch it off. And when you pinch off a nerve, in the same way as if you go to sleep laying on your arm and you wake up with a numb arm, you can make your facial nerve temporarily paralyzed in the short term, or if it's more severe, actually with physical nerve damage, which takes a while to repair. And the result is that you lose the ability to control the muscles those nerves would have projected into and sent messages to. Now, you interestingly mentioned that it happened when you're pregnant. This is quite common. And one of the reasons for this is that when women are pregnant, the distribution of fluid changes around the body. People often say when they're pregnant that they gain weight not just because of the pregnancy, because they get fluid retention. Your body preserves and conserves fluid differently during pregnancy and also during the menstrual cycle, as many women will attest, for various reasons. But the acquisition of extra fluid into the tissue means that if something becomes more swollen, it's more likely to get pinched off. So these nerves can get squeezed more when you're pregnant because of that swelling phenomenon. And one other reason, you mentioned shingles. Shingles is another reason why this can happen, because people can get a condition called Ramsay-Hunt syndrome, where herpes viruses, which live in the nervous system, can sometimes come out into the ear, and as a result of that, squeeze the nerve via that route. So we often, when someone presents with a Bell's palsy, a droopy face, we'll look in their ear to see if there's any vesicles, like little blisters of these viruses, and that would be a giveaway that that is what is happening. In terms of the recovery from this, it depends on how severe it was. If it was a mild manifestation and it's quite quickly brought under control, you can give steroids, for example, which can help. You give some acyclovir if it's caused by herpes. If it's a mild case, sometimes it recovers quite quickly. If it's a reversible thing, like a woman's pregnant, she has the baby and then the extra fluid disappears, this can also help. But if you end up with a more severe manifestation, and it sounds like yours was quite serious because you've still got some persistent changes, what has happened is that squeezing on the nerve damages the nerve fibers inside the nerve and disconnects them from the muscles. The good news is that the peripheral nervous system does regrow and reconnect, but it does take time. So usually you'll see that over a period of weeks to months, you'll get a slow reconnection of the nerves back into the muscles that have been divorced from their nerve supply, because the nerves grow back following the path of the original nerve, and this does lead to re-establishment of the connections, and you get back most of the movements. So I would stay optimistic. It's only a short-term thing so far. hopefully with time you'll get back those extra missing movements, and then you'll make a full recovery. But I suspect that was what was happening in you.
Ali Sue says it's a long shot, Dr. Chris Smith. She says, but will Botox not help keep the eyelid up?
Well, Botox, made by Clostridium botulinum, is a toxin that paralyzes the connections between nerve cells and muscles. It irreversibly binds to the apparatus inside the nerve ending, or the muscle end plate, which triggers the impulses that make a muscle contract. So that's how it achieves its paralyzing effect. Eyes actually are opened by nerve activity, and eyes droop when you don't have enough nerve input. So if you put Botox in there, you'd actually have more droopy eyes, not less droopy eyes. The way Botox works to iron out wrinkles is by paralyzing nerve inputs to discrete parts of the front of the forehead, for example, and you make the muscles contract a bit less hard so they don't pull the brow into furrows. That's how you get a flattening effect. We do occasionally use Botox therapeutically in people who have muscles that are too contracted. There are some conditions, for instance, in people with cerebral palsy, a problem acquired around the time of birth, where people get contractures of muscles. Sometimes paralyzing certain muscle groups can help people hold their joints or affected body parts in a more natural position, which is less uncomfortable for them, for example. So we do occasionally do that, but it wouldn't be the right thing to do under these circumstances.
And it looks as if we'll have to wrap it up. It just goes so very quickly. But he's back. Dr. Chris Smith, the Naked Scientist, is back. He will be back next week at 9:30. Some of the questions that we are not able to get through to him today, we'll hold over for next week then. That appointment back in place. After 9:30, right here on Views and News.
Join the conversation.
Join the conversation.
You're with Cape Talk.